세 개. Distinguished guests, ladies and gentlemen, good afternoon. Our session will be start. Please be seated. Welcome to the World Bio Summit 2022. It is my great honor to introduce myself to you as the MC for this very special occasion. I am Yuran Kim, working with Korea Health Industry Development Institute. Now, we would like to resume discussion session number 5, Global Diagnostics Development Trends and Prospects. Thank you very much for joining both online and offline. Before we begin, I would like to give you some housekeeping announcement. During the session, we would like to provide simultaneous interpretation service. For those who need any translate service, please use the receivers on your tables. Channel number 1 is for English, number 2 is for Korean. For those who are attending online, I also advise you to set the interpretation language as either English or Korean. Thank you. In this session, we would like to analyze the industry paradigm shift in pre- and post-COVID-19 in terms of promising technology and product trends and identify the pending issues. Also, in order to respond to them, we would like to discuss cooperative measures, including international joint research, technology transfer, and so on. As you can see on this stage, we are joined by 2 presenters and 3 panelists for sharing their knowledge and insights. And this session will be chaired by Ms. Hui Yang, the head of Supply Operations Department at Global Fund. Global Fund was established in 2002 as a cooperative organization to raise funds for the prevention and treatment of HIV, tuberculosis, and malaria worldwide. Ms. Yang directs the sourcing, procurement, and supply functions of the Global Fund to accelerate the end of the epidemic. She joined the Global Fund during the COVID-19 pandemic when the value and the importance of its supply operations has never been so clear. She leads a team to develop shift and imaginative interventions that ensure access to life-saving health products in some of the world's most complex environments. Ms. Yang brings over 20 years of experience in procurement and supply chain across the public and private sectors. She championed sustainability initiatives focused on the life cycle management, partner ecosystem management, and innovation. Ladies and gentlemen, now please join me in welcoming our moderator, presenters, and panelists with a big applause. Ms. Yang.
Thank you. Thank you, Ms. Yuran Kim, for the introduction. I take you can hear me well? Okay. And thank you all for the interest in the session, Global Diagnostic Development Trends and Prospects. Since the Global Fund's creation 20 years ago, we have made notable progress on prevention, diagnostics, and treatment interventions to fight HIV, tuberculosis, and malaria in more than 100 countries. As of the end of 2021, the Global Fund Partnership has saved more than 50 million lives from these 3 diseases, and we plan to save 20 million more lives in the coming 3 years. At the onset of the COVID-19 pandemic in March 2020, with the support of our generous donors, the Global Fund has made more than 4.4 billion dollars available to countries to respond to the pandemic. The funding has enabled countries to adapt existing programs, access essential COVID-19 tools, helping to mitigate the overall impact of the pandemic. Among the essential COVID-19 tools, the Global Fund has secured the supply, capacity, and scale deployment of diagnostic solutions across all the countries we serve, thanks to the companies developing the tests to respond to the needs, expedited review and market authorization by WHO and national authorities, and funding and pragmatic decisions that were taken to support the rapid deployment. These tests over time became more affordable and deployable at more decentralized levels. However, many lessons learned are to be drawn centered around the need for more equitable access, local manufacturing, innovation, responsive supply chain, and efficient delivery, as we heard during the opening ceremony of the World Bio Summit just yesterday. We have witnessed what was possible when the global health actors come together. The first COVID-19 rapid test was made available in scale by the Global Fund in September 2020, 6 months after the declaration of the pandemic. This is an unprecedented speed. However, this is not sufficient to be prepared for the future global health crisis and pandemics. This first World Bio Summit called upon global health actors to take stock, to reflect, to build on lessons learned from the COVID-19 pandemic, and ensure that we continue to make progress, be better prepared, and more able to respond with speed, determination, and equity. Today's session on global diagnostic development trends and prospects is centered on two key aspects. Number one, the needed paradigm shift on the diagnostic device industry to ensure better and more cost-effective diagnostic solutions. And second, cooperative measures for the global diagnostic device industry to contribute to equitable access to quality-assured tools and services. I'm honored to chair this panel discussion alongside my colleague, Dr. Bill Rodriguez, Chief Executive Officer of FIND, the Global Alliance for Diagnostic, and 3 industry representatives, Mr. Dae-Han Kim, General Manager of bioMérieux Korea, Mr. Dae-Yong Ho, CEO, SD Biosensor, Dr. Song-Yu Kim, Senior Vice President, Global Marketing Center, CGen, and finally, Mr. Bob Min Kim, the CEO of Korea Medical Device Development Fund. We will start with 2 short presentations delivered by Bill and Mr. Dae-Han Kim, and then we would engage in a dialogue with all the panelists. With that, over to you, Bill.
Thank you very much, Wei, and good afternoon, everyone. It's really a pleasure to be here today and to talk through the diagnostics challenges that we've seen through COVID. Many of you are familiar with FIND. For those of you unfamiliar with FIND, we serve as the Global Alliance for Diagnostics, and our mission is to make sure that there's equitable access to diagnosis everywhere in the world. We work upstream by funding R&D programs for critical tests that are needed. We support clinical trials that lead to policy change at the WHO, and we work on implementation programs to bring diagnostic tests into healthcare settings, and we do that on a global basis with offices here in Asia, in Africa, and in Europe. Before I talk about the changes we've seen under COVID in the global diagnostics landscape, let me just highlight the baseline from which we're operating. Last year, in the midst of the pandemic, the Lancet Commission on Diagnostics released a report, and the headline figure is that 47% of the world's population cannot get a diagnosis today. That's almost 4 billion people who cannot get diagnosed for a health condition when they present at a health facility. And it's especially acute at the primary healthcare level, but also at a hospital level as well. So at FIND, what we've learned from this gap is how to think about where tests are used in the world, and we think about 3 settings. The first is at home and in the communities, and we've all learned from COVID the power of easy access to self-tests and rapid diagnostic tests that we can access at a pharmacy or in a nearby facility. And those tests are primarily RDTs, or rapid diagnostic tests. At the primary care level, in addition to RDTs, we need true point-of-care systems, small instruments that can do a limited menu of tests that are affordable and accessible at the primary healthcare facilities. And at the hospital level, we see a big gap in the need for near-patient point-of-care tests, larger instruments with a broader menu that are still affordable and able to address multiple diagnostic needs. When we think about where we stood on these 3 different areas of need before the pandemic, we had large centralized instruments in laboratories, shown on the right here. At that near point of care level, we really only had 2 systems, one from an Indian company, Molbio, one from an American company, Cepheid, that were widely available in many countries in the world. And we had rapid tests for some key conditions, but we really hadn't exploited the self-test agenda yet, or opportunity yet. The first innovation under COVID that really made a major difference was with self-tests, including from SD Biosensor here in Korea, getting those tests out to everyone on a global basis. But probably the longer lasting impact of COVID on the diagnostics innovation front is what we're seeing in an explosion of tests and platforms that can meet the needs at this near patient, primary care and district hospital level, many of which are shown on the slide here. So at FIND, we think about what can we do to harness this innovative energy and to drive equitable access to tests at these different healthcare settings that have had this major gap affecting half the world's population. And we focus on 5 areas. The first is to make sure that the right tests that are appropriate for use across the world are developed and supported with R&D funding and validated through appropriate trials. The second is to make sure that there's equitable access to manufacturing, and that's highlighted in pink here in this slide. That local production based on strong manufacturing technologies, including transfer of technology from mature industries to parts of the world where the manufacturing systems for tests are not yet mature. And that's an important part of FIND's agenda coming out of the pandemic. In addition to R&D and local production, we also support access terms so that companies have sustainable businesses, profitable businesses at a fair margin that also provides affordability for the countries where the tests are most needed. We build on the existing platforms, particularly our colleagues at the Global Fund, to make sure that there are clear procurement pathways for companies entering these markets. And then FIND also works with national governments to make sure that tests are prioritized in their health system budgets and in their health agendas, and that there's a clear set of target menu so companies know which tests are going to be in high demand across the world. Okay, with those points in mind, let me just highlight some of the key trends. The first is, with COVID, we saw a quantum leap in the market size and the number of tests that were procured on a global basis in Africa and the Middle East, in Latin America, and in the Asia-Pacific region. You can see that jump from 2019 to 2020. We see that trend continuing during COVID and persisting after COVID as more and more countries and more health systems recognize the critical role of testing in delivering high-quality test care. Overall, we see that growing to a $38 billion market opportunity for just those parts of the world, for those critical gaps I identified in the earlier slide, driven by increasing interest in bringing better testing to the primary healthcare level in Africa, in Asia, and in Latin America. Let me just end by giving a few examples. There are many more than these, but these are some of the more prominent ones. First is the malaria test market. As you may know, malaria has a $12 billion annual economic impact, and addressing it requires global attention. Currently, about $3 billion each year is made available for funding to address malaria. Almost a third of that and close to a half of that in the coming years will go towards the purchase of tests. And the bulk of those tests are going to be rapid tests. So there's an ongoing need for malaria rapid tests. It continues to be a global scourge. 4 billion people are at risk, and the need persists and perhaps is even heightened through the course of the COVID pandemic. Another example is tuberculosis. And many of you are familiar with the impact of tuberculosis here in the Korean Peninsula. Today, 1 out of every 3 people with active tuberculosis goes undiagnosed. That's 3 million missing cases undiagnosed each year. And the need there is for simple tests, but we see that the market will be driven by molecular tests. These novel molecular platforms that are emerging from the pandemic can drive a response to TB that begins to identify those 3 million missing cases. That market is likely to be up to $3 billion per year for tests just for tuberculosis, the bulk of which will be in the Asia-Pacific region. And then finally, I'll just highlight the point of care and near point of care market. What we see is a transformation in diagnostics to tests that don't just identify one disease. They don't say, do you have COVID? Let's test you for COVID. Do you have tuberculosis? Let's test you for tuberculosis. Rather, from a single sample from one patient, you are able to say, which disease of these many respiratory illnesses do you have? And that is a transformative step in our ability to deliver high-quality testing and to address this gap on a global basis, driven by innovation, much of it coming out of the Korean diagnostics industry. Just in 4 countries, India, China, South Africa, and Brazil, the near-patient molecular testing market will likely grow to $500 million in the coming years and will continue to grow in the decades to come. I don't need to tell all of you that South Korea has a leadership role in health technologies. It's why we're all here at the World Bio Summit. We know that the Korean market for medical devices is $8 billion a year, but the global testing market is massive and needs more attention from the Korean diagnostics industry. COVID has revealed that, I think, to a number of companies, but the opportunities and the need are both significant, and we at FIND would like to engage many more Korean companies in addressing these markets with the kinds of tests that can deliver the performance and the accessibility and the affordability that's needed. So I'll just highlight, there's been a lot of attention at this meeting and in other meetings about the opportunities for vaccines. What are the different models? What are the business cases? Where does the funding come from? How do we focus on building capacity here in Korea to support technology transfer and training on biomanufacturing for vaccines? Those issues are all appropriate for diagnostics as well. And my question to many of you and the conversations I've had this week with government and with some of our industry partners is, how can you leverage the success we've seen in the vaccine industry to address this growing global demand for affordable, high-quality diagnostics? We believe the Korean diagnostics industry is both well-positioned and essential to that agenda on a global basis. A few quick examples and then I'll end. We've worked closely with a number of companies. So one critical disease that's limited to Africa is called sleeping sickness. Working with Standard Diagnostics, which is now Abbott, we supported the R&D and implementation of a test for sleeping sickness that's driven a global elimination program. 2.5 million tests in a select set of countries in Africa now have this terrible disease on the brink of elimination in the next 5 years. We have other partnerships that extend to COVID, to glucose testing, and to technology transfer from some of the companies here in Korea to partners in Africa, notably a new diagnostic effort to build manufacturing capacity in Senegal to address the needs across Africa. So this is just a select list of the companies that we work with. We're eager to work with many of you and to address the global need. So I appreciate our ongoing partnerships and look forward to working with many more of you. And I'll just end by thanking all of our sponsors and funders, including the Right Fund here in Korea, and our continued engagement with the government here. 감사합니다. Thank you very much.
Right. Hello, everyone. I'm Taewan Kim from bioMérieux. I'm so pleased to stand in front of you to discuss about this important topic of diagnostic trend technically in the post-COVID-19 area. I think there's some similar message that I have put in my slide with what Dr. Rodriguez just mentioned, but I think there will be some different perspective. So hopefully there will be some different insight and balance for you. Okay. The massive amount of tests has been performed for COVID-19 testing for last 3 years. In 2021 alone, there has been like 3 billion reported COVID-19 testing. But the number can be much higher if you include self-testing and unreported tests. So this is like tremendous diagnostic demand that has not been existing before. So the impact of this is something that I will be discussing about in the next 10 minutes for my presentation. So what is it that COVID-19 brought to diagnostics? It's a big change, right? So is it technical innovation or is it innovative way of implementing those technology? So on the left side, you see a lot of platforms and system that has been used for COVID-19 diagnostic testing, which I don't see anything new from pre-COVID-19 time. So we have been actually using the technology and system that has been existing in the market and somehow use it for COVID-19 testing. And on the right side, you see a whole bunch of different innovative way of implementing those technology, for which I've never seen before COVID-19. So I think there is both technology and the way the technology is used that's innovative. And this kind of agility, unprecedented agility, is not just about self-testing or different way of testing. It's about regulatory and financial support that made facilitation of early market access of COVID-19 testing. And then WHO and the local health authority and medical association, who has been very efficient in providing guidelines for COVID-19 testing. And the capacity expansion from the industry side, it took some time. There was some delay in the initial phase, but it was pretty fast in terms of ramp up, because we had the infrastructure and the technology to be used readily for COVID-19. So I think it's like tremendous amount of teamwork from different segments, from public and private. And I think as a person who's been working for diagnostics field for 20 years, I feel the importance of diagnostics has never been highlighted this much before. So the question is, are these all development, are these all relevant to post-COVID-19 or non-COVID-19 diagnostics? Or is it, are these all sustainable? So I think many of these are relevant to non-COVID and post-COVID-19 diagnostics, but not all of them will be sustainable. Okay, so to set, having those questions set aside, let me look at the IVD industry perspective. So looking at industry IVD, COVID-19 test business is estimated to be about somewhere between 50 to 100 billion US dollar in 2021 from more than 700 different test providers. But we know COVID-19 is getting under control. So for industry, the industry is in the situation that we have capital and capacity built from COVID-19 testing, but we are not really sure what we will do with this capacity in the post-COVID time. Sorry, I think there's one slide missing. Okay, I think one slide missing. So when it comes to COVID-19 testing, the capacity that we have built, we are talking about so-called pandemic preparedness, right? So before talking about pandemic preparedness, I would call it like bio preparedness, because it's not just about pandemic. We have other disease that we have been dealing with from a long time, and routine diagnostics for those non-pandemic, non-COVID testing is also important. When it comes to test, We have developed those technology, as Bill just mentioned about, POC testing and molecular testing that can be readily used for different pathogen and different pandemic. But there is something beyond test itself. Looking at what is happening in the laboratory side, usually it takes only 5 minutes or a few minutes to a few hours for the test itself. But you have to think about all the time that's taking before and after test. So that's that's really about laboratory workflow and the system in the hospital that's helping to enroll those testing and utilize those information where the action is need to be taken. And when it comes to biopreparedness, so as I said, it's not just a pandemic. It's not just about something big. We've been dealing with infectious disease for a long time in a routine basis. So for COVID-19, about 6.6 million people's life has been lost during COVID-19 period. But even without COVID-19, in 2019, there was 8 million people died from infectious disease, and 5 million out of it is associated with antimicrobial resistance. Malaria alone can kill more than half a million people every year, and flu is taking similar toll. So when it comes to post-COVID-19 industry trend, we have to revitalize our testing capacity for those routine disease. So just for example, we have syndromic testing. We've been talking about multiplexing, right? Syndromic testing that's that can identify pathogen from a particular syndrome by testing broader potential pathogen. And this kind of syndromic testing is not only for patient diagnosis, it can be very effective in the pathogen surveillance to identify outbreak and prepare for pandemic. So this kind of technology has been very much implemented in the diagnostic field, and innovation in this technology is even enabling diagnosis of syndromic testing in 1 or 2 hours. So this is an example of a technology that we have to drive transition from COVID period to post-COVID period so that we can be prepared better for next pathogen or next pandemic. Beyond diagnostics, I'm just talking about, I wanted to talk about something beyond diagnostics because COVID-19 has been causing major disruption and backlog in healthcare. So one of the topic is antimicrobial resistance. COVID is not treated with antibiotics, right? But somehow use of antibiotics has been increasing quite dramatically in everywhere in the world. So I don't have a full picture, but the alarming report saying that more than 70% of patients in early stage of pandemic has been treated with antibiotics, although it is not really treating COVID-19, but somehow for prophylaxis or as part of routine practice, antibiotics has been used very much. And in countries in the region like Central South America, there was a report of having almost like 100% patient hospitalized COVID-19 patient getting treated with antibiotics in the year 2021. Even in the report from US, this is a report from US CDC talking about increased hospital-acquired infection during the pandemic period. It's not all about antibiotics misuse. There are other reasons like increasing hospitalization and the short of resources in the hospital. So, but nevertheless, we know there is a good proven correlation between hospital-acquired infection and antibiotics resistance. So this is becoming a big post-COVID topic in US as well. So when it comes to AMR, antimicrobial resistance, tackling AMR is a big global agenda, and the diagnostic is an integral part of fighting against AMR, and especially for access to rapid diagnostic solution is identified as a key element of tackling antibiotics resistance. So to kind of summarize, when it comes to technical innovation, I want to highlight beyond technology, we have to think about the environment that's enabling all this existing technology to be effectively used to generate value. And then for emerging innovation, we have to continue having flexibility to facilitate market access of this emerging technology in terms of regulation, in terms of funding. And lastly, I want to highlight that it's not just pandemic, it's not just about one pathogen, it's our bio preparedness, so that we can be prepared for pandemic and any other important pathogen to come to threat our safety. Thank you.
Thank you, Mr. Kim, and thank you, Bill, for this very insightful presentation. And just building off the biopreparedness and coming back to today's discussion about what is the before and during and post-COVID pandemic trend and activities we need to take. One thing we also learned is that diagnostics can be seen very often as part of the first-line defense during a pandemic response, together with the PPEs and social distancing. Now, how do we make sure that we actually ensure equitable access to diagnostics, and particularly in countries where operating environment is more difficult and the supply chain challenges are immense. And so with that, I would like to turn to you, Mr. Tae-Yong Ho, to share your thoughts on and the intervention that SD Biosensor has been thinking and undertake in this regard. Over to you.
Thank you for question. I'm Taylor Ho, CEO of SD Biosensor. Nice to meet you. I think there is at the most three backgrounds of the localization topics. One thing is, as you mentioned, after COVID pandemic, technology transfer and strengthening the local production and diversifying the supply chain is one of the main topic to drive more equitable access to our health products. And another one is last year, since January 2021, there was Africa continent free trade agreement commenced. And now many African countries are promoting localization for major diagnostic tests and other health products with the aim for industrialization and economic growth and further development. And the third one is at the same time during the COVID pandemic, global IVD manufacturers invested huge money for production capacity building. And now, frankly speaking, I think we have more over capacity than the market demands as far as COVID testing products related. And this might lead the market to severe price competition and can be potential risk in terms of sustainability of the industry. I think some minor companies can collapse down and discuss collapse down of supply chain mechanism eventually. At the same time, so if we consider more cost effectiveness, production efficiencies, and affordable access to a diagnostic test, it's not sure whether the local manufacturing facilities can have better competitiveness than global major companies. But it will be clearly meaningful on a long-term perspective for helping the industrialization of low developing countries, and also diversifying the supply chains. And our company also have a clear vision to support these programs. In the beginning of a scale up the production capacity to supply more product to the customers, actually the harder problems we meet were sourcing materials, for instance. Scaling up our own capacity was not difficult for us, but sourcing materials from vendor companies, we also have to cooperate with vendor companies. And there is a lot of issues, molding cassettes, housings, and flock swap sourcings, and also limited flights to the countries for supply. So there was another big issues. So I think same problems can be happened when the local manufacturers are looking for these kind of material sourcing when new pandemic to occur. So, and we hard to think smaller local companies can source those raw materials better than those global leading manufacturers. So we have to think about when we proceed the localization. Anyway, to procure the product using the Global Fund and USAID, also we need WHO PQ, and so support from FIND or PASS or CHAI to do this kind of evaluation and registration of approvals. And setting up production facilities alone by the manufacturer will have too much risk for themselves. So roundtable discussions and cooperation involving all stakeholders, I think it will be essential to make a success of this localization. Thank you.
Thank you, Mr. Ho, and completely agree that the challenge of the local manufacturing of diagnostic solutions can be very complex and difficult, and would require multi-stakeholder approach and solutions over time to make it sustainable and feasible. So and you did mention about the raw material and then ancillary parts to that. So we will come to that a bit later. But maybe just a bit more insights about the PCR test. So we hear from Bill that as a point of care solutions and being closer to the affected people, point of care is continue to be important, and PCR has been one of the great solutions to achieve that, particularly the ones that they decentralized solutions. So with that, Dr. Song-Yu Kim, we would love to hear from you on the side of PCR development. Over to you.
Thank you. Thank you. It is an honor to participate in this great symposium. My name is Song-Yu Kim, working in the CGN. I propose new concept of PCR testing for post-pandemic era. We are challenging for living with COVID. COVID still poses a lot of threat. We learn from COVID pandemic. We know proactive, frequent PCR testing is key, but there is hurdles. In overcome the hurdle and improve current PCR testing, we propose AAA PCR testing. First, A means affordable price of accurate syndromic test. During the pandemic, PCR testing capacity infrastructure expanded even into a small and medium-sized clinic and hospital. There was a lot of technical innovation for assay development and lab automation. Those kind of environmental change will be the beneficial for achieve affordable price of testing. But we have to keep in mind, in IBD, we have to consider affordable price as well as test quality. I appreciate FIND. I also ask to FIND to keep focusing on the standardization and as new assay validation. And another second A is anyone, including asymptomatic. Public awareness of PCR is increased. People already got a proactive COVID PCR testing. Global COVID surveillance network is established. It is time to encourage clinic to open the regular PCR checkup program with the extended menu. And also it is time to upgrade current global surveillance program, expand to the pathogen related to climate sensitive disease. Third A is accessibility to the community and anywhere testing. We made a special mobile app to management as booking to final test result notification. And there are a lot of sample collection center in the city, but still limited in rural area. I want to ask the government or Asian Development Bank or Global Fund to consider enhancement of national healthcare system using mobile lab to increase accessibility, improve capacity of the testing lab. AAA PCR testing can change paradigm shift from the conventional testing procedure to AAA procedure. AAA procedure focus on anyone. Individual can decide order the test. Test procedure is simple and quick response. The another key point is price. We suggest $12 end user price for 4 multiplex SARS-CoV-2, Flu A, Flu B, RSV. It is example of the test price. CGen have a key element for requirement for AAA testing. We already launched 100 different syndromic assay. We provide full automation and mobile station. It is mobile lab system. We also establish AI-based assay development system. We can develop the assay quickly. From this April, we start new campaign. Name is In Life PCR campaign. Now we are working in the local partner in 10 different countries. For example, in Vietnam, our local partner offer the respiratory syndromic test for Grab taxi driver. In Italy, to our local partner, offer regular-based PCR checkup, not only COVID, STI, HPV, GI. I think current national healthcare system focus on symptom-based patient care. But in post-pandemic era, we have to change. We have to focus on the preemptive healthcare for anyone, for total population. I think our approach can manage asymptomatic infection, also extend to from the infection disease to the genetic disorder and oncology. Also, it can reduce the anxiety of the triple-demic, endemic in public. It is another approach to preparation for the new pandemic in near future. Thank you.
Thank you, Dr. Kim. So now we have heard about the great trend that has been developed throughout the COVID-19 pandemic, and the question is about what do we need to do to sustain those trends. And we have heard about so sustainability came up almost throughout all the presentations so far, and then we also heard about the enabling environment that is needed to sustain those positive trends and be more prepared for the future pandemic. So with that, I would like to turn to you, Mr. Bob-Min Kim, just to talk to us a little bit about the public-private sector partnerships and collaborations, particularly also on the side of raw material development and biopreparedness going forward. Over to you.
Thank you very much. Thanks for inviting me to this session. I'm very honored to be in this panel. My name is Bob-Min Kim. I'm a professor of the School of Biomedical Engineering of Korea University. I'm also a CEO of the Korea Medical Device Development Fund, in short, KMDF. KMDF is in charge of medical device R&D support in Korea, and it is a large-scale project at the government level that supports medical device R&D through investment of 987.6 billion won, which corresponds to 700 million US dollars for over 6 years. Among the various medical devices R&D fields that we support, IVD medical device is one of the key areas. As you are very well aware of, South Korea's response to pandemic was pretty fast. The reason why domestic companies were able to respond quickly during COVID-19 was because they already had technology to commercialize molecular diagnostic reagents and diagnostic kits. Of course, lessons were learned from SARS and MERS. And more lessons should be learned from our current experience for the future virus outbreak. Regarding in vitro diagnostic medical devices area, which is the focus of today's session, I'd like to talk about the current status of domestic R&Ds, prospects, and suggestions from two perspectives. First, many original technologies have been developed through continuous research for decades, and many products with excellent performance have been developed. However, the sensitivity problem of the immunodiagnostic technology known as rapid test and the complex analysis process of molecular diagnostic technology represented by PCR still require further innovation as a reliable quarantine tool. In other words, there are many issues to be solved, such as immunodiagnostic products with high sensitivity and easy to use and inexpensive molecular diagnostic tools. Therefore, it is absolutely necessary to develop a new breakthrough technology by converging various technologies, such as micro-nanotechnology, optical technology, and digital technology to simplify the diagnostic process, shorten the diagnosis time, and improve the sensitivity and specificity. Second, in the recent COVID situation, the global value chain, the supply chain of diagnostic devices production is collapsing, which is said to cause a lot of pain in the industry. Recently, President Biden of the United States announced a biomanufacturing initiative emphasizing the domestic production of bioproducts. Therefore, it is becoming increasingly difficult to produce products under the global supply chain. Now, the domestic medical device manufacturers, including diagnostic equipment and reagents, are forced to find ways to produce them using local supply chain. Basically, we need to diversify the collaborative partnerships. In particular, the government will need to recognize in vitro diagnostic medical devices as important assets from the perspective of the national health security and establish strategies to prepare for another pandemic situation in the future. KMDF is currently investing about 18.8 billion won for a total of 80 individual projects related to the in vitro diagnostic R&Ds. The main items include technologies for cancer, Parkinson's disease, Alzheimer's disease, antibiotic sensitivity, and infectious disease such as COVID-19. In addition to the advanced technologies, we are also support projects for domestic production of raw materials such as DNTP, nucleic acid extraction reagents, and fluorescent substances, since many of them rely on imports and have a weak domestic production base. KMDF will continue working closely with the government to establish mid- and long-term investment strategies in the field of IVD medical devices for continuous growth. We are open to new ideas and projects, and if you have good ideas, please contact us. Thank you very much.
Thank you, Mr. Kim, for the insightful information and update about the trend on the research front. And it's also good to hear that Korea is also pursuing a local manufacturing effort for the raw materials. I think for now we would have covered the key topics that that we want to share with you today, and we would like to then open up the floor to see whether you have any questions or some comments that you want to discuss with us. Yes, please. And just to note that very easy questions I would try to answer, and the more difficult one I would then refer to my panel members.
Sure. My name is Hun Sang Lee, and I'm the Chief Strategy Officer of the Right Foundation. It's really great to see there is not only FIND, it's really great to see FIND as well, but also with the Global Fund as well, together with many of the biomedical manufacturers for the diagnostics present. My question will be, from the beginning, I think one of the important aspects that had been raised up in this World Bio Summit is the aspect of the end-to-end strategies. So I think it is really important from the very beginning of the development process to have a longer-term foresight and also about a very good target product profile, and eventually about the longer-term procurement strategy as well. But I think it would be great to have all these discussion together, including with eventual funding partners like Global Fund, but with a careful approach of fair and just procurement process as well. But I was wondering if there is that kind of overarching discussion that are happening currently. Probably you are already having one, as you can see that you are here together on the in this panel together. But I just wanted to hear from maybe either from Global Fund or FIND or any other partners who are represented here.
Thank you, and thank you for the great question. So if I may just play back on what we have here in terms of question is, and a more end-to-end solution would be or has been required and would be required when it comes to pandemic preparedness and response. So, and personally, I think that is very much needed at the different level. You mentioned some on the delivery level, so from the R&D to actual development of the solution, to production, manufacturing, all the way to the supply chain and to the delivery. And and I'm glad that you also mentioned maybe Bill from FIND can speak to some of this. But again, from the Global Fund's perspective, we do believe this end-to-end approach is very, very important. And but also one thing I would like to add is why we part of the preparedness is also about national health system strengthening, because that is the best way and the most sustainable way for country to be prepared, to be ready to respond to any health crisis or pandemic outbreak should there be in the future. So with that, Bill, would you like to take up the question?
Sure, thanks very much. I'll just make three very brief comments in response. First, I completely agree with the premise of your question, and that we need an end-to-end coordinated strategy at FIND, because we work so far upstream on the R&D agenda with academics and industry partners, and we work downstream on procurement through our partners like the Global Fund. We see the need for a coordinating role that we can help play, because without an end-to-end strategy, everything is too fragmented. So I appreciate the question and agree, and we hope we can play a central part of the response. Second is just to give one very quick example, monkeypox. So monkeypox, endemic disease in Africa, probably there's a demand of 100,000 tests per year, maybe slightly higher depending on how far we can reach with the appropriate tests. zero investment, zero products on the market, no one paying any attention to it. Then with the emergence globally, we saw the demand probably increase to maybe 500,000 to 1 million tests in this past six-month period. 53 suppliers entered the market in the first month and got tests through some regulatory agency, and the capacity and the supply went way up. Then now the demand is dropping close to zero again outside of Africa, but in Africa will continue to be 100 to 200,000 tests per year. All of those suppliers are leaving the market. So there's no coordination and no strategy about that one disease, and we saw the impact. And it was mentioned here by the other panelists about this overcapacity for COVID and our lack of planning for what to do with that capacity moving forward. And then the third final comment is just to emphasize what Hui just said, which is we see the need to coordinate by looking at primary health care and universal health coverage to do routine testing for routine diseases and to integrate that with pandemic surveillance, because if we're not testing for routine conditions everywhere in the world on Monday and Tuesday, we'll never pick up the pandemic signals on Thursday and Friday. So it has to be a unified agenda, and we need coordination across that agenda from end to end.
Thank you, Bill. Any additional points? No. Thank you. Thank you for the good question again. Any other questions from the audience? No? I know that we have shared a lot today, and you are probably still in the process of or in processing those information. But maybe just in conclusion of the session, again, next there is also a parallel session next door that is focusing on vaccine. And probably they are discussing how they can develop new vaccines within 100 days. Now, I did mention that diagnostic is being seen as part of first-line defense, and vaccine is being seen as a second-line defense when it comes to pandemic response. So I think the question that I have for our panel members here and in the audience is, if the vaccine community is taking up the 100 days challenge, what would be the diagnostic community's response to that? 60 days? So again, not to put anybody on the spot, but I just want to encourage all of us to think about it. And again, in the response, speed is everything. And I believe there was some statistic being shown by Richard yesterday about there is a absolute correlation between life saved and the speed of response. So I see that Mr. Kim, you want to take a number, make a suggestion?
Actually, before talking about the number in terms of days for implementing those technology, basically when it comes to molecular technology is very replicable for different pathogens. So it's not the technology that's really limiting the speed of implementation of the new tests for new pathogen. It's more of a regulation. It's more of a time taking for evaluation. So that's why I keep emphasizing in terms of flexibility for regulation, in terms of market access pathway that needs to be reviewed. But we're not going to balance this out for the safety, right? So this kind of flexibility may not be suitable for routine diagnostics, but when it comes to pandemic and any kind of important pathogen, we have to have that flexibility in the system.
Thank you, Mr. Kim. And this is absolutely key regarding the very important point you mentioned about regulatory framework, and probably I would add on it is about the quality assurance, because anything and everything we want to introduce as a new tool, new solution in the healthcare domain will need to be safe and needs to be secure. And and actually over the lunchtime, there was a conversation about how diagnostics is probably the area where there's the least standardization and harmonization when it comes to regulatory regulations. So I'm just looking across the panel here and to see whether there's any reflection on that, and why this is continue to be important. That this World Bio Summit indeed is a collaborative and cooperative efforts, and co-hosted by our colleagues from WHO. Who is we know and we work with to drive that important agenda on regulatory framework strengthening and harmonization. But I don't know. I'm looking over to the Ms. Kim or Bill. You want to?
Yeah, I'm happy to make just a few comments. So just like Mr. Kim said, in the diagnostics sector, we can move very quickly. And so once the sequence for SARS-CoV-2 is identified, the first primer sets, the first kits for PCR were shipped from Germany in 72 hours. So much faster than 100 days. But we still saw poor access to test for years because of some of the other barriers. So it's not so much the R&D agenda, although for the 10 priority pathogens, 5 don't have any tests in development right now. So we still need to focus on R&D. But these other issues about the barriers from a regulatory pathway and making sure that that's clear. At FIND, we've been working with the Global Fund with others to try to strengthen and harmonize regulations, especially for pandemic diagnostics, but also for endemic diseases. And I think the challenge is just as we heard, to balance the need for these tests with the risks and the quality systems. And we haven't found the sweet spot yet. So we need to continue to improve on those. The WHO is committed to that, but there's work to be done to make it more standardized, more straightforward, and clearer what is the process for getting a high quality test into the market. And there's work to do as we move out of the acute phase of COVID to address that issue.
Thank you, Bill. And with that, again, I want to just take a moment to thank all of you being here with us today, and thank you for your attention, but also special thanks to my fellow panel members for your great insight, intervention, and thoughts, and more importantly, the work you do to take us forward from here. Thank you.
Thank you, Ms. Yang. Ladies and gentlemen, so far we have discussed with the agenda global diagnostics development trends and prospects. Now we would like to wrap up the discussion session here. Thank you again for your attendance, and thank you everyone, the panelists, the presenters, all, and moderator, Ms. Yang. We are going to have the wrap-up session of World Bio Session 2022. It will be continued at Vista Hall, located on the basement level 2. It will start from 4:30. Please join us again, and thank you very much for your attendance again. Thank you.
you.